44 after the hour, the Doug Stefan's Good Day program with Jai Kershner. Okay, you've heard me talk any number of times over the past month or so about my eyes and what I had done. I was really, in a way, I was tired of the glasses, and they kept changing, and you get all kinds of different exams, Jay, and I wasn't satisfied wearing glasses, so I came across, as a result of people always ask me, why do you get all this stuff in Los Angeles? Well, it's because I have more time there to do these sorts of things. And my daughter put me on to Ryan Stybel, who's a great ophthalmologist. All right, here, I'm going to ask Dr. Benjamin the same thing I've asked many other eye doctors, and I still don't know the difference between an ophthalmologist and an optometrist. All right, you're on. Dr. Arthur Benjamin from the Benjamin Eye Institute here with us. What's the difference?
Good morning, friends from Los Angeles. The difference is that optometrists are doctors of optometry. They really focus more on glasses and contact lenses. Ophthalmologists finished medical schools, residency programs, and so as a board-certified ophthalmologist, I don't just treat disease medically, but also do surgery. And I had a chance to do yours, as you remember. So,
how could I forget?
Right. Cataract surgery is really something. It's the most commonly performed procedure in the Medicare system, as far as I know. And by age 65, when most people become eligible for Medicare, I believe something like 50% of patients have already had surgery. So it's a very common procedure. And it's becoming more and more common, and is done at an earlier age now because it is such a quick and precise and safe procedure. We do it with the help of a femtosecond laser. So modern cataract surgery is done with a laser. And the recovery is so quick that as soon as we roll the patient out of the operating room, they can already see better than they did before. So very satisfying procedure for both surgeon and the patient. It's done under topical anesthesia. That means just eye drops. I mean, most people get Vicodin from it.
Right. I was surprised when it was. I had all kinds of. I didn't have misgivings, but you teased me because it took me 3 years. I'd known you for 3 years. It took us 3 years to get to this point. I don't make decisions like this quickly, and I was back and forth with a couple of different people, and you and your, I suppose, bedside manner as much as anything else. But the idea of having someone do this to your eye, I think, puts people off, even though, as you've said, lots of people have had this surgery or something similar to it. So what's the difference, I guess? A lot of people listening, they've heard of LASIK surgery. What's the difference between what you're talking about and LASIK?
Right. So LASIK is what we call a corneal refractive procedure. LASIK is a procedure that we do on the cornea. LASIK is actually an acronym. It stands for Laser Assisted In Situ Keratomileusis. LASIK is usually done with, of course, it's done with a laser, but it's a different kind of laser, and it's on a surface of the eye. Cataract surgery involves actual removal of a cloudy lens and replacement with a lens implant. And
that's what I had.
Yeah, exactly. And LASIK is usually done in a laser suite. We have one in our office. You've probably seen it, this area behind the glass. Right. Cataract surgery is done in an operating room. So it's usually in a surgery center, ambulatory surgery center.
One of the things I liked about... Go ahead. Well, we're running out of time. I wanted to acknowledge and I want you to come back again, because I think this is something that a lot of people are considering. And by the way, if you are, why not call the best, Dr. Benjamin at the Benjamin Eye Institute. Go to benjamineye.com, all right? EYE, obviously, benjamineye.com. Dr. Arthur Benjamin here on Good Day at 10 minutes for the hour.